हमारे यहाँ पर एक इनफर्टिलिटी कहा जाता है, बांझपन जिसे कहा जाता है, युवा महाविद्यालय ने इस विषय पर भी फोकस तरीके से शोध अनुसंधान और इस पर किस तरह से आयुष के माध्यम से हम लोगों को फायदा पहुंचा सकते हैं, उसके बारे में विचार विमर्श शुरू किया है। वेबिनार भी इस विषय पर शीघ्र आयोजित कर रहे हैं और हम चाहते हैं कि आयुष के माध्यम से ऐसी महिलाओं का भी इलाज हम लोग ठीक से कर सकें जिन्हें काफी समय से संतान उत्पत्ति नहीं हुई है। अभी लोग एलोपैथी की तरफ भागते हैं, लेकिन मैंने अपने विषय विशेषज्ञों से चर्चा की है तो उनका कहना है कि इनफर्टिलिटी का इलाज हम लोग बहुत अच्छे तरीके से कर सकते हैं। दूसरा हमारा विषय इसी अनुक्रम में है कि जब एक महिला गर्भवती होती है तो गर्भवती होने के प्रारंभ से लेकर के अंत तक उसे कई प्रकार की तकलीफों का सामना करना पड़ता है। यदि प्रारंभ से ही हम उसकी दिनचर्या, रात्रिचर्या, आहार विहार और योगासन आदि आदि उसकी दैनिक क्रियाओं को अपनी देख रेख में लेंगे, उसे गाइड करेंगे, उसे मार्गदर्शन देंगे, तो एक वो स्वस्थ सुंदर शिशु को, बालक बालिका को जन्म देगी और साथ ही उसे किसी प्रकार की बीमारी नहीं होगी, तकलीफ नहीं होगी, आराम से वह जन्म प्रसव दे सकेगी। हम लोगों ने इस बात की भी चिंता मार्च से पहले जाहिर की थी कि आजकल देखने में आता है कि अधिकांश संस्थानों द्वारा, एलोपैथिक संस्थानों द्वारा या व्यक्तियों द्वारा सिजेरियन डिलीवरी का प्रचलन है कि जैसे ही मतलब महिला को थोड़ी बहुत तकलीफ हुई तो डिलीवरी के लिए सिजेरियन कर दिया जाता है। लेकिन मैंने अपने विभाग के सभी प्राचार्यों से और इस स्त्री रोग विभाग के प्रोफेसर से, उनके एचओडी से चर्चा की थी। उनका ये मानना था कि यदि प्रारंभ से ही हम किसी महिला की, गर्भवती महिला की देखभाल करेंगे तो हम नॉर्मल डिलीवरी करा सकते हैं। मेरे सामने अभी एक किस्सा मेरे स्वयं के देखने में आया कि एक महिला को, जिसको एलोपैथी में ये बता दिया था कि बिना सिजेरियन के इसकी डिलीवरी संभव नहीं हो पाएगी, लेकिन हमारे आयुर्वेद के एक चिकित्सक हैं, मेरे परिचित ही हैं, उनने उसमें प्रयास किया, बल्कि उनकी माताजी ने, वो भी आयुर्वेद की चिकित्सक है, उसमें प्रयास किया तो बिना किसी तकलीफ के उसे नॉर्मल डिलीवरी हुई। बालक अभी स्वस्थ है और बहुत अच्छे से उसकी देखभाल हो रही है। तो एक जो हमारा विषय है कि हम इनफर्टिलिटी के साथ साथ में जब महिला गर्भवती हो जाती है तो गर्भवती होने से शिशु के जन्म तक उसे किसी प्रकार की तकलीफ न हो और एक नॉर्मल डिलीवरी हो, इस पर हमें आयुष के माध्यम से किस प्रक्रिया से किस प्रकार हम लोगों को लाभ पहुंचा सकते हैं, अपना संदेश दे सकते हैं और उसका इलाज कर सकते हैं, इस विषय पर हमें अभी आगे काम करने की आवश्यकता है। साथ ही साथ जब एक शिशु होता है तो हम देखते हैं कई बार जब बालक बालिका का जन्म होता है तो उसमें कई प्रकार की तकलीफें होती हैं। उन तकलीफों को न हो, एक सुपोषित, एक अच्छा स्वस्थ बालक या बालिका जन्म ले, इस विषय की चिंता भी यदि हम प्रारंभ से करेंगे तो जो बालक या बालिका जो होगा वो स्वस्थ रहे, उसे किसी प्रकार की बीमारी ना हो, इस बात की भी चिंता हम आयुष में बहुत अच्छे तरीके से कर सकते हैं। हमारे इस प्रकार के संसाधन उपलब्ध हैं, इस प्रकार की हमारे यहाँ औषधियाँ उपलब्ध हैं, इस प्रकार की क्रिया प्रक्रिया उपलब्ध है कि हम ये सभी काम बहुत अच्छे से कर सकते हैं। हमें ज़रूरत है कि जनमानस में हम अपनी बात कई बार ठीक तरीके से पहुंचा नहीं पाते हैं, या हम फोकस तरीके से ट्रीटमेंट नहीं कर पाते हैं। इसके लिए हमने मध्य प्रदेश में ये विचार किया है कि हमारे जितने 7 आयुर्वेद के महाविद्यालय हैं, अलग-अलग फोकस्ड विषयों पर चिंता करेंगे। मुझे इस बात में भी थोड़ी-सी दिक्कत हुई कि जब मैंने विभिन्न महाविद्यालयों का निरीक्षण किया, तो किसी एक महाविद्यालय में या उसके संलग्न चिकित्सालय में बहुत अच्छे से स्त्री रोग विभाग काम कर रहा है, वहाँ पर प्रसव हो रहे हैं, लेकिन दूसरी तरफ देखने में आता है कि वहाँ पर 2 या 3 स्त्री रोग विशेषज्ञ होने के बावजूद, पूरा स्टाफ होने के बावजूद भी वहाँ पर किसी प्रकार की डिलीवरी नहीं हो रही है, या महीने में 1 या 2 डिलीवरी होती है। ये भी हम सबके लिए चिंता का विषय है। जो संस्थान के मुखिया, प्राचार्य या इस विभाग के मुखिया यहाँ पर उपस्थित हों, उन्हें ये भी देखना चाहिए कि हम किस प्रकार से अपने यहाँ, अपने संस्थानों में अधिक से अधिक गर्भवती महिलाओं को ला सकते हैं और उनको अपने यहाँ नॉर्मल डिलीवरी करा सकते हैं। हमें उनके लिए सभी सुख सुविधाएं, साधन उपलब्ध कराना चाहिए और इस दिशा में मध्य प्रदेश शासन की तरफ से मैंने सभी को कहा है कि जो भी आवश्यकता होगी हम उसको पूरी करेंगे। इसी प्रकार से जब बालक एक हो जाता है या बालिका हो जाती है, उसके बाद में वो कुपोषित ना रहे, स्वस्थ रहे, इस दिशा में भी हमें लगातार अभियान चलाने की आवश्यकता है। एक हमारा स्वर्ण प्राशन योजना इसको भी हम नए रूप में ला रहे हैं, जिसे पूरे मध्य प्रदेश में हम लोग लागू करेंगे कि इस पर भी पिछले दिनों में वेबिनार हुआ था। इसमें भी अलग-अलग प्रकार के मतभेद हैं। कोई कहता है कि हमें नित्य प्रति पिलाना चाहिए, कोई कहता है महीने में 1 बार पिलाना चाहिए, कोई कहता है कि साल में 6 बार पिलाना चाहिए, कोई कहता है 12 बार पिलाना चाहिए। डोज़ की भी अलग-अलग लोग अलग-अलग प्रिस्क्रिप्शन देते हैं। तो एक जो मत भिन्नता है हमारे लोगों के बीच में ही, तो हमें एक निश्चित पॉलिसी बनानी पड़ेगी, निश्चित प्रिस्क्रिप्शन बनाना पड़ेगा कि हमें कितने साल के बच्चे को कितने दिनों तक और किन परिस्थितियों में उसे स्वर्ण प्राशन कराना है, जिससे कि उसमें रोग प्रतिरोधक क्षमता विकसित हो सके और किसी प्रकार की बीमारियों से वो ग्रसित ना हो। इसी प्रकार से जिन बच्चों में कुपोषण की समस्या है, कुपोषण पे भी हम एक अभियान चलाना चाहते हैं कि कुपोषण की समस्या को किस प्रकार से आयुष की औषधियों के माध्यम से, साथ ही साथ मालिश वगैरह विभिन्न प्रकार के तेल जो आयुष विभाग निर्मित करता है या बाजार में उपलब्ध होते हैं, या और उसकी दिनचर्या, आहार विहार को हम लोग नियंत्रित करके या उसे ठीक से समझा बुझा करके कैसे बच्चे को स्वस्थ रख सकते हैं ताकि उसमें रोग प्रतिरोधक क्षमता विकसित हो और किसी प्रकार की बीमारियां ना हो। इस विषय पे भी हम सबको सोचने की, चिंता करने की जरूरत है। मैं इस विषय का विशेषज्ञ नहीं हूँ, क्योंकि मेरा प्रशासनिक क्षेत्र में लंबा अनुभव है, तो मैं सोचता हूँ कि आयुष विभाग को इन सब चीजों के लिए उपचार, प्रक्रिया और औषधियां उपलब्ध कराना चाहिए, लोगों में जागरूकता लाना चाहिए, जन जागरण अभियान चलाना चाहिए और आयुष आईसी के माध्यम से हमें लोगों को इसमें जागरूक और उनके मन में ये विश्वास दिलाना चाहिए कि आयुष विभाग भी इस संबंध में हमें अच्छे तरीके से स्वस्थ रख सकता है और हमारी व्याधियों को दूर कर सकता है। आज का वेबिनार का विषय यही है और मैं चाहता हूँ कि जो हमारे विषय विशेषज्ञ या अन्य लोग जो हैं, इस विषय पर चिंता करते हुए एक सार्थक चर्चा करेंगे, जिसका लाभ हमारे यहाँ पर प्रतिभागी जितने हैं, उन सबको मिलेगा और आगे आने वाले समय में भी ये दोनों विषय हम लोगों ने अभी आत्मनिर्भर अभियान में भी स्वास्थ्य विभाग ने लिए हैं, कि जिसका नाम हम लोग बार-बार अपने यहाँ बोलते हैं कि गर्भ संस्कार कार्यक्रम या बाल अमृत योजना के रूप में, सुपोषण कार्यक्रम के रूप में विभिन्न कार्यक्रम हम लोगों ने बनाए हैं और इसमें हम लोग अभी विस्तृत गाइडलाइन भी शीघ्र ही जारी करेंगे। तो मेरा आप सबसे अनुरोध है कि इस पर विस्तृत चर्चा करें और इसको पूरा डॉक्यूमेंटेड करें। मैं जितने महाविद्यालयों में गया था ये भी देखा मैंने कि इन सबके डॉक्यूमेंटेशन की अभी महाविद्यालय स्तर पर कमी है। प्रॉपर डॉक्यूमेंटेशन होना अनिवार्य है ताकि हम ये बात अपने तथ्यों के साथ में कह सकें, आंकड़ों के साथ में कह सकें कि इस व्याधि का इलाज हम कर सकते हैं, इस समस्या को हम आयुष विभाग के माध्यम से मुक्ति दिला सकते हैं। आज के इस वेबिनार के लिए मेरी ओर से बहुत-बहुत शुभकामनाएं और आप सभी को धन्यवाद कि आपने इस तरह का ये वेबिनार आयोजित किया और आज के इस वेबिनार से ये अच्छे परिणाम निकलेंगे, अच्छी चर्चा होगी, जिससे हम सब लोग लाभान्वित होंगे। धन्यवाद।
धन्यवाद सर। आपने अपने व्यस्ततम समय में से हमें जो अमूल्य क्षण प्रदान किए, महाविद्यालय परिवार आपका आभारी है और हम आपको विश्वास दिलाते हैं कि आपके द्वारा दिए गए दिशा निर्देशों का पालन हम सदैव करेंगे। मैं यहाँ पर जुड़े हुए सभी प्रतिभागियों को यह अवगत कराना चाहता हूँ कि माननीय डॉक्टर एम.के. अग्रवाल सर आईएएस सचिव सह आयुक्त के निर्देशन में कोविड-19 में मध्य प्रदेश के आयुष विभाग द्वारा न केवल प्रदेश में बल्कि देश में उच्चतम ऊंचाई को प्राप्त किया है। इसके लिए आयुष हमारा महाविद्यालय परिवार एवं समस्त आयुष विभाग आपका सदैव आभारी रहेगा। अब मैं विषय विशेषज्ञ व्याख्यान के लिए और कार्यक्रम की रूपरेखा प्रदान कार्यक्रम में क्या रूपरेखा है उसके विस्तृत वर्णन के लिए स्त्री रोग एवं प्रसूति तंत्र विभाग में पदस्थ डॉक्टर सुजाता शाम कुमार को आमंत्रित करता हूँ, वे आए और अपने कार्यक्रम की रूपरेखा प्रस्तुत करें।
Assistant Professor in the Department of Prasutitantra and Stree Rog. I welcome you on the behalf of the Government Ayurvedic College, Jabalpur and Indore, Madhya Pradesh. At the onset, I would like to thank respected Shri Ramkishore Kavre sir, Minister of Ayush Department, Madhya Pradesh, and our Secretary and Commissioner, Dr. N.K. Agrawal sir, for initiating the webinar series and giving an opportunity to our college to arrange the webinar in Prasutitantra and Stree Rog department. Thank you, sirs, for your inspiration and being here. I would like to extend my gratitude towards respected Dr. Satish Chandra Sharma sir, Principal, Government Ayurvedic College, Indore, and respected Dr. L.N. Airva sir, Principal, Government Ayurvedic College, Jabalpur, for their support. Today, we are very fortunate to have eminent personalities like Professor Dr. Sujata Kadam ma'am, Dean and Head of the Department from All India Institute of Ayurveda, New Delhi, and respected Professor Dr. Ashokan B. Sir, Head of the Department, Parul Institute of Ayurveda, Parul University, Gujarat. स्त्रियां बिना सृष्टि एवं नास्ति. स्त्री के बिना सृष्टि की कल्पना भी नहीं की जा सकती. To get healthy progeny, she must be healthy. For sustainable growth and development of country, there is a need to improve maternal child health care. Today's session is based on this concept. During pregnancy, what type of care should be taken to avoid complications? And if she has bad obstetric history, then what type of management should be done through Ayurveda? We know Ayurveda has potential to diagnose and treat the cases and the causes on its own way. So, before starting the session, I request to all participants, mute your mic. And if you have any query, please mention it in chat box. After the session, Dr. Narayan Mishra sir will conduct the question answer session. So, now we will start our first session. Our first speaker, Dr. Sujata Kadam ma'am, is the Dean and Head of the Department of PTSR at All India Institute of Ayurveda, New Delhi. She has a rich academic and clinical experience of more than 25 years in the field of Prasutitantra and Stree Rog. Ma'am is a skilled surgeon and performs obstetrical and gynecological surgeries. She has guided many postgraduate and PhD scholars. She has been awarded the Best Teacher Award by Maharashtra University of Health Science, Nashik in 2010. She has published and presented a number of research papers both nationally and internationally. Today's topic, bad obstetric history, is a serious health problem and is associated with increased risk of maternal and perinatal mortality and morbidity. I request to Sujata Kadam ma'am to throw more light on this topic. So over to you, ma'am. Please continue.
Namaskar. Thank you, first of all, to all of you for inviting me, especially Principal of Government Ayurvedic College, both Government Ayurvedic College, I should say, for giving me this opportunity, and Dr. Sujata, who is the coordinator, and Dr. Narayan, Dr. Pankaj. So I thank you all, and respected Dr. N.K. Agarwal sir, Secretary of Government of Ayush, MP. I thank him that he is organizing such a great webinars for education of all the practitioners or teachers or students or in the field of Ayurveda, for taking the efforts to educate all peoples in this pandemic situation. And I will start my presentation. I would, hello, can you please allow me to share my screen?
Yes, ma'am. आपको मैं host बना रहा हूँ मैम, फिर आप screen share कर सकते हैं.
Yes, it is not allowing. मेल कर दो उनको, दरवाजा खुला रखो।
मैम यू आर होस्ट नाउ मैम।
ओके ओके।
And just I am requesting to you, after complete your lecture, we will unhost to you. Hello.
Yes, yes, sure, sure, no issues. My screen is, I am sharing my screen. Is it visible?
Yes ma'am, yes ma'am.
Okay, okay. So the topic given to me for today's webinar is bad obstetric history and its management through Ayurveda. So this topic, actually this is a very challenging topic, and when we are practicing in obstetrics with the Ayurveda, I must assure you that you will be getting a great success in such a type of cases where modern medicines has many limitations. We have many good medicines and procedures. With that, we can treat such cases where the success rate is very high. I'm practicing in this field since 25 years. And I must share you that yes, I have treated so many such cases with our protocols. Just to follow all the things very meticulously, what is scientific should be done. And I am sure that yes, you will get a success with Ayurveda treatment. First of all, what is the BOH? BOH, I think coordinators asked me about that I should speak in Hindi and English mixed language. So I will try that surely. If anything is not understood by any participants or whatever queries, you can ask in the last sessions. So I will try in the both language. So प्रेग्नेंट लेडी जब हमारे पास आती है तो क्या हम लोग कब उसको BOH कहलाते हैं? So the pregnant lady, the BOH term is applied to a lady where the present obstetric outcome is likely to be affected adversely by nature of previous obstetric disasters. That means lady में ऐसी history है कि previously abortion है, previously IUD है, previously some mishaps है with related to fetus. So that we can term as a BOH mother, and the management of such patient should be different from a normal antenatal case or normal antenatal care, and you should be very vigilant and very meticulous about treating such patients and how to treat such cases. In BOH, what should be included? That yes, as you all know that abortions, whether it is first trimester or second trimester, then IUGR, repeatedly IUGR, or in previous pregnancy, the severe IUGR was there, or IUDs, stillbirths, repeated stillbirths, anomalies in the fetus, and neonatal deaths due to some neonatal conditions, neonatal deaths. So that if such type of history is there with the patient, that patient, that lady, we can term as she is having a bad obstetric history, and which is now going to harm her present pregnancy, because the cause which was present at that time or in the first pregnancy may not be rectified in between. And if she comes with you with the second pregnancy, the cause, if cause is there present in her body, this pregnancy will be definitely affected due to that cause. That means if the abortion was there previously, if cause is not treated with the treatment, or cause is not elevated with any of the measures, this time also she may have the abortion, or she may have the IUD, or she may have the IUGR. So we have to rectify what is the cause. But if the patient visits you in pregnant state, it is difficult to rectify the cause at that time. We can only give the supportive treatment for the pregnancy, and in mild form, some type we can elevate the cause. But if the patient visits your clinic before pregnancy, before the next pregnancy, that मैंने पिछली बार जब प्रेगनेंसी रही थी तो अबॉर्शन हो गया था, और मैं इसलिए आई हूँ कि इस बार ये सारी चीजें रिपीट न हो जाए, और in between that pregnancy she had visited you, that period is very good to find a cause and to treat the case. So if the patient visits in between the pregnancy, that is a very good case to treat. If she again comes to you with the pregnancy, that is little bit difficult, but still with the Ayurveda, we can manage such cases very nicely. In this presentation, I will share, I am going to cover abortions and IUGR, not other causes, because these are the two main causes which are hampering the outcome of the pregnancy many a times. That means patient visits us with such type of history many a times, so that I will be dealing, and the cause for IUGR or IUD may be many a time same, which is related to abortions. So that can be treated with Ayurveda treatment. So I will be dealing with these two conditions in this the presentation. And initially, I will share one case of mine, which is very old case. Actually, when I was working in Pune, this is a relative of mine also, and she came to me with the history. She was pregnant 4th time and having history of previous 3 abortions. And in present pregnancy, she was bleeding. She had a history of bleed and recovered with that bleeding problem. And after that, she visited my hospital. So this time she was having a placenta previa. If you are watching the screen, there is a diagnosis pregnancy complaining with pale bleeding, placenta previa. It was central placenta previa. And she was with the previous 3 abortions. And the 3 abortions were G1, that means pregnancy 1 was 1.5 months abortion, pregnancy 2 was 2.5 months abortion, pregnancy 3 was 2.5 months abortion again, and this was the 4th pregnancy. So the 4th pregnancy was in between, after the 2 pregnancies, 2 abortions, she had done all the investigations which generally modern doctors are doing. All the investigations which are responsible for the abortions, all the investigations she had done, like torch, always is done by the doctors, then lupus anticoagulant, then anticardiolipin antibodies, which was positive. Then semen examination was also done. Then karyotyping, both the partners karyotyping was done in hospital. So both partners were genetically normal, no anomaly was detected. This is prothrombin time, that was also done. And the patient visited to me. Patient when visited with the pervaginal bleeding, that time we have given the treatment, admitted the case, and mild bleeding. Actually, she recovered with the heavy bleeding in the hospital where she was admitted. Then after that, mild bleeding was there. So she is treated with the Masanumasik Kashai, Durvaswaras, Masanumasik Kashai, which are their tablets are available actually of many pharmacies. Or if it is not available, you can give directly a quath to patients, because it is a treatment of Chalita Garbha Chikitsa or Yonigat Raktasrav during the pregnancy. So it is giving a very good results in cases of abortion or in the bleeding per vaginum during the pregnancy for other causes also. So Masanumasik Kashai Vati you can prescribe to the patient. Then Durvaswaras I have given, then Kamadudha. And Gairik and Shatadhauta Ghruta lep was done on the lower abdomen, because astringent action we need, and Pitta Shaman, that is Stambhan, we have to give that patient, because to further manage a pervaginal bleeding, or she should not have further episodes of pervaginal bleeding. So the management was like Durvaswaras continued, Then Kamadudharas also continued and Masanamasi Kashaya also continued. Whenever possible, we are giving the Gairik and Shatadhauta Ghruta late to her. And yes, as you know, the constipation should not be there in placenta previa cases. So Draksha, that is Kala Munakka, it was given to the patients. And yes, she was having the threat of preterm delivery also, because if the major episode of bleeding will be there, then that pregnancy and repeatedly major episodes of bleeding, if found in that patient, that pregnancy may get to be terminated. So prematurity risk was there in the patient. So I have started with the Suvarnamalni Vasanta. Suvarnamalni Vasanta Kalpa gives you a better results in lung maturity for the fetus also. So that treatment continued and the patient delivered, not delivered, but cesarean section, planned cesarean section done at the gestational age of 35 weeks for the repeat episodes she had, and the 35 weeks cesarean section done. But the baby weight was very good and baby survived. The rest and diet which was continued. So such type of case, if appear to our clinic, this is a very typical case of bad obstetric history. And after that, she recovered and the baby was very good. After post-Caesar, the condition is very good. But after that, after 3 or 4 years, she wants another child with such a bad obstetric history. And after that, what we thought, this treatment, because what I said initially, that in between the pregnancy, we can treat such cases very what you can say, with very good result outcome. So I have examined the case totally. She is a key Prakruti was having Prakruti is Pitta Pradhan Vatanubanti, Dusha was Rakta, Rasa, and Artha was Rotas. While history taking, I have seen examined her, and in history that Rakta Dushti was there, lots of acne, Daha, and menorrhagia. Many symptoms are indicating that she is having Rasa Rakta Dushti. She is a chronic case of anemia also. And Arthavas Rotas Dushti, that is menorrhagia repeatedly. See, according to me, it was the typical case of Asruja Yoni Vapat. So, the history was taken, and the bleeding, the history what she was giving at the time of abortion as bleeding always preceded by the other symptoms. That means bleeding starts previously, then other symptoms, and with that the patient aborts. So it is a typical case of Asruja Yoni. So after the Mahatikta Ghrita and Pachan, after the Pachan of Musta and Shunti, Snehanavit Mahatikta Ghrita was given, and then Virechan was given. What was planned is Basti and Uttar Basti with Jandal Bala Lakshadi Tel, and Pichu also planned. But due to many reasons, that is not possible. And she again got conceived, and Dhadi Madhi Gruta was continued after the conception. And after the second pregnancy, she had very uneventful second pregnancy. So such cases we can deal because of स्लाइड्स बहुत ज़्यादा हो रहे थे, इसलिए सेकेंड प्रेगनेंसी के मैंने बहुत सारे स्लाइड्स नहीं दिखाए यहाँ. बट सेकेंड प्रेगनेंसी वेंट अनइवेंटफुल एंड she delivered, not delivered, but planned cesarean section this time also, but this time not placenta previa, and she delivered a very good child, male child. So such type of cases, when visits to our OPD, what I said earlier, that if they present with pregnancy, the treatment or the thinking, it should be different one. That should be a supportive treatment for pregnancy, or whatever the mishaps are going to happen, that should be reduced with our treatment. But if in between the pregnancy, we can treat such patients very nicely. Yes, we face always the recurrent pregnancy loss, and we should know why we are facing this problem repeatedly, because this is a major cause of pregnancy losses, spontaneous pregnancy loss, in fact, the most common complication of the pregnancy. That is most commonly seen all over the world. So we should be more concerned about it. Most of the pregnancy losses are unrecognized. About 70% of human conceptions fails to achieve the viability. That means this much is read, and estimated 50% are the lost before the first missed menstrual period. That means patient को पता ही नहीं चलता है कि pregnancy थी और वो abort हो गई है. Typical like a Vamini Yoni which is described in Ayurveda. That means the rate is such a high. So that's why the text have explained the Vamini Yoni for the treatment. And clinically recognized loss occurs in 50% before the 20 weeks of gestation. So such cases we are facing in our clinics. Whether Ayurveda is saying anything about the BOH, not exactly you will find the BOH term or whatever the term related to this, but as you know, बहुत सारी जगह डिस्क्रीट होते हैं रेफरेंसेस और हमें इकट्ठा करने पड़ते हैं कि इस तरह के रेफरेंसेस यहाँ हैं और हम लोग इस तरह से उसका विचार कर सकते हैं एंड वी कैन गो फॉर द ट्रीटमेंट. सो इन वंध्या, इन हारित संहिता, द रेफरेंस इज गर्भस्रावी वंध्या. दैट मीन्स रिपीटेड एबॉर्शंस. देन मृतवत्सा वंध्या, माधव निदान परिशिष्ट में लिखा है कि जिसका बालक मृत ही जन्म होते हैं. देन कन्या प्रसूर्या इज ऑल्सो टेकन इन वंध्या एज माधव निदान, बिकॉज उस तरह की जो कुछ सामाजिक परिस्थिति थी उस टाइम पे कन्या प्रसूर्या लोगों को भी वंध्या में लिया है, क्योंकि कुल वृद्धि जो है वो पुत्र से होती है. जो भी उस टाइम के जो सामाजिक परिस्थिति थे उस प्रकार से उन्होंने कन्या प्रसूर्या को भी वंध्या में ही लिया है. दैट मीन्स if you are not having a male child, that means you are Vandhya, like that. So Madhav Nidan is saying that. Then Bhruyatrahi mein Asruja Yoni, Putragni Yoni and Vamini Yoni. These are all related with BOH like cases. Asruja Yoni mein pregnancy abortions repeatedly देखने मिलते हैं. Then Putragni Yoni, as you know, जाते जाते विनशति या स्थितम स्थितम विनशति, दोनों प्रकार की चीजें हमें देखने को मिलती हैं. वामिनी योनि as I said. Then 80 प्रकार के जो वात व्याधि बताए हैं उसमें गर्भनाश भी एक कारण है. दैट मीन्स वात का वृद्धि गर्भनाश का कारण हो सकता है, तो वात को कंट्रोल में रखना बहुत जरूरी है. गर्भव्यापत जो डिस्क्राइब किए हैं बहुत सारी जगह, गर्भस्राव, गर्भपात, मृतगर्भ, लीनगर्भ, उपविष्टक, नागोदर, ये सारे ही बीओएच अगर ये रिपीटेडली होते हैं तो ये सारे बीओएच में आ जाते हैं. देन काश्यप ने जातहरणी बताई है. उसमें बहुत सारी जातहरणी है, 3 प्रकार की, कालत्रयी और जो जातहरणी है उसमें फुल टर्म आईयूडीज है. नाकिनी में स्टिलबर्थ्स होते हैं. मोहिनी में इम्प्लांटेशन डिफेक्ट एंड एबॉर्शंस है. देन पिशाची और पुण्यचनी में नियोनेटल डेथ्स है. सेकेंड ट्राइमेस्टर आईयूडीज में का वर्णन है. दैट मीन्स बहुत सारी प्रकार की जातहरणी जो है वो काश्यप ने फिटल आउटकम जो है वो बैड होने के लिए रिस्पॉन्सिबल है वो बताया है. सो अगर आपके पास केस आते हैं ऐसे कि प्रीवियस हिस्ट्री ऑफ एबॉर्शन है या प्रीवियस हिस्ट्री ऑफ आईयूजीआर है, आईयूडी है या स्टील बर्थ है, जो भी है, स्टील बर्थ का कारण अगर लेबर रिलेटेड है तो वो लेबर मिसमैनेजमेंट है. लेकिन अगर वो लेबर रिलेटेड नहीं है और बाहर आते आते फिटस की डेथ हो रही है एंड दैट इज रिलेटेड टू फिटस, सम प्रॉब्लम इन द फिटस, सो दैट कैन बी डील विद द अदर एस्पेक्ट. और लेबर रिलेटेड अगर प्रॉब्लम है तो वो लेबर मैनेजमेंट सही से करना, यही इसका हल है. सो तो बैड ऑब्स्टेटिक हिस्ट्री की अगर केस आपके पास आई तो व्हाट इज द कॉज बिहाइंड इट, क्यों बार बार ऐसा हो रहा है. रेक्टिफाई द एबनॉर्मलिटी इफ पॉसिबल. अगर एबनॉर्मलिटी जो भी है वो हमारे हाथ में है, रेक्टिफाई करना पॉसिबल है तो कर सकते हैं. लाइक सम जेनेटिक एबनॉर्मलिटी अगर है और रेक्टिफाई कर नहीं सकेंगे तो वी कांट डू एनीथिंग. और एनाटॉमिकल डिफेक्ट है, बहुत बार यूनिकॉर्नियट यूट्रस है एंड रिपीटेडली अबॉर्ट हो रही है पेशेंट, तो बहुत बार ऐसा होता है कि हमारे हाथ में सारी ही चीजें नहीं होती, समटाइम्स वी हैव ऑल्सो द लिमिटेशंस। तो लिमिटेशंस को पता करते हुए आगे जाना बहुत सही रहेगा। तो अगर बहुत सारी चीजें लेकिन हम ट्रीटमेंट से रेक्टिफाई कर सकते हैं, जो कि फिजियोलॉजी में प्रॉब्लम आने की वजह से बैड ऑब्स्टेटिक हो रही है हिस्ट्री, तो उसमें हम लोग आराम से बहुत अच्छे से डील कर सकते हैं। देन यस, इफ शी गॉट द प्रेग्नेंट, हमने एबनॉर्मलिटी तो रेक्टिफाई की है बट प्रेगनेंसी रह गई और छोड़ दिया, ऐसा तो नहीं होगा। वी हैव टू रिमेन विजिलेंट टिल डिलीवरी की अगेन दिस थिंग्स आर नॉट हैपनिंग, वी हैव टू स्टिल रिमेन विजिलेंट। etiological factor as I said may be genetic, may be hormonal causes तो आजकल बहुत ज्यादा बढ़ रहे हैं, like hypothyroidism, PCOS and diabetes also. So this type of factor also increasing nowadays, so we have to be vigilant and be careful. Maternal immune response and maternal infections, these are also the causative factors. Contributory factors may be demographic, social, medical, psychological, behavioral and environmental also. Like अभी कोविड पैंडेमिक आया है और बहुत स्ट्रेस है, तो मे बी IUGR का रेट या अबॉर्शन का रेट क्या बड़ा है क्या, क्योंकि स्टिग्मा है, एक बहुत बड़ा सोशल स्टिग्मा है, बहुत फियर है, तो ये दिस कैन ऑल्सो बी एडवर्सली अफेक्ट द प्रेगनेंसी आउटकम. So such type of things are there. We certain have to rectify, certain our things are not in hand. So by finding the etiological factors, what we should look for, तो जो चीजें बताई है कि गर्भ के लिए गर्भ की वृद्धि बहुत अच्छे से हो और वो परिपूर्ण हो, बल वर्ण सत्व संहनन से युक्त बच्चा जन्मना चाहिए, ऐसी चीजें के लिए क्या क्या रिस्पॉन्सिबल चीजें हैं, तो वो है अनुपहतरेतस, मतलब शुक्र, अच्छा शुक्र, अच्छा आर्तव, योनि शोणित गर्भाशय, वो सारी चीजें बहुत सही हो. देन जीव उपक्रम इन दैट फर्टिलाइज्ड और कंसीव्ड ओवम, एंड साथ में रस उपयोग और उपचार, मतलब dietary factors and behavioral factors equally responsible for whole fetal growth and what you can say the entire things or garbhoposhan as are dependent on it. So we have to look whether when we are treating such a cases, we have to look for all these factors and we have to rectify all the factors. Yes, as earlier said, Rutukal, Kshetra, Ambu and Bija, these are Garbha Sambhav Samagri, and any problem in this will lead to the bad outcome for the pregnancy. This will lead to infertility also, but this will lead to bad outcome of pregnancy also. So we have to rectify all those things. So when the patient visits you, what you should do for the patient to find out the cause? So depth history, in detail history. The case which I shared, that the history, in detail history, like tell me the sequence of the symptoms appeared during the abortions. When we asked that, then only she gave the history that yes, without any pain, without anything, bleeding starts first and then other symptoms like pain and all. So the in-depth detail examination, her total body examination, sarvadehik parikshan, sarvasrotas parikshan is very necessary. And yes, investigation. Nowadays, investigation part is much necessary, and we should do whatever investigations are required for this, and we can find the factors related to this also. And sometimes we have to start the conventional medicine also. So investigations are very necessary. When we are looking for the Srotas examination, see for the Rasa Rakta Srotas, Mansava Srotas and Shukrava Artava Srotas. Both male and female partners should be examined. यस, कोष्ठ, निद्रा, अग्नि, जो भी हम लोग जो परीक्षण करते हैं स्त्री में या पुरुष में, जो भी पूरा सर्वदेह परीक्षण है वो करना है। डाइट की हिस्ट्री जरूर लेनी है, डाइट, एडिक्शन एंड व्हाट ऑक्यूपेशन शी इज डूइंग, वो डिटेल हिस्ट्री हमें चाहिए, सो लेनी पड़ेगी। यस, एब्स्टेटिक हिस्ट्री तो लेनी जरूरी ही है कि पहले प्रेगनेंसी में क्या क्या हुआ था और कैसे हुआ था, व्हाट वेर द कॉजेस दैट टाइम, वो तो है। बट यस, मेंस्ट्रुअल हिस्ट्री बहुत जरूरी है कि पहले मेंस्ट्रुअल हिस्ट्री क्या थी, बिकॉज इन sometimes we find the cause in menstrual history also, because approximately 2/3 of early pregnancy failures there is evidence of defective placentation। और डिफेक्टिव प्लासेंटेशन क्यों होता है, मतलब 2/3 प्रेगनेंसी डिफेक्टिव प्लासेंटेशन से अफेक्ट होती है। तो डिफेक्टिव प्लासेंटेशन क्यों होता है, तो अच्छा एंडोमेट्रियल लाइनिंग बहुत बढ़िया नहीं है, अंदर से ग्रो हुआ और बहुत अच्छा नहीं है, तो देन डिफेक्टिव प्लासेंटेशन होता है एंड फर्दर कॉन्सिक्वेंसेस हो जाता है। तो अगर आप मेंस्ट्रुअल हिस्ट्री अच्छे से लोगे तो एंडोमेट्रियल जो थिकनेस है, या हम लोग जो बोलते हैं कि रज का उपज है, अच्छा हुआ है या नहीं है, ये हम लोग देख सकते हैं। और उसका वर्ण क्या है, प्रमाण क्या है, गंधक क्या है, स्वरूप क्या है, उससे अगर दुष्टि है, रज की दुष्टि है किसी भी प्रकार की, वात दुष्ट रज या पित्त दुष्ट रज, दैट विल डेफिनेटली गोइंग टू अफेक्ट द प्रेगनेंसी। तो ये हिस्ट्री से आपको पता चलेगा, एंड दैट यू इफ यू विल रेक्टिफाई बिफोर द प्रेगनेंसी, दैट विल improve the outcome of pregnancy definitely. So menstrual history should be given equal importance. Any inflammation, infection, ड्राई है या योनि, पर्सपेकुलम एग्जामिनेशन आप कर रहे हो तो कैसी है वजाइना, देन स्पर्शन में स्पर्श कैसा है, यूट्रस साइड शेप एंड एवरीथिंग, yes, USG we should do, and if needed HSG and laparoscopy. Sometimes we can diagnose the the repeated history of abortion. If we remove that septum, that अरे संजू को बुला जल्दी। हेलो
हाँ जी मैम।
हाँ, yes, I think there is a net connection problem.
Yes ma'am, yes ma'am.
Yes.
ma'am.
I think the video screen sharing stopped.
Yes, ma'am.
Yes ma'am.
I think the screen
Not
share
having-
has been stopped. So it is,
Yes,
I think, क्या हुआ देखो,
Ma'am,
बंद
you
हो
are host, you can share ma'am.
हेलो।
Hello ma'am, you are host, you can share.
Yes. Is it visible now? Actually, no,
Yes, ma'am,
there
yes,
is
ma'am.
some connection problem.
Okay ma'am, yeah.
Ma'am, slides are not visible.
It is not visible now.
Slides not. Madam, slides.
No, यहाँ तो visible हो रहा है. I am sharing the slides. नहीं, कहाँ हो रहा है देखो।
बाहर आ गया इसमें शेयर मोड ये ना मैं
नहीं,
अब आएगा।
हेलो।
Yes ma'am.
हाँ, is
Ma'am,
it
now it is visible. Yes, ma'am.
okay?
It is visible,
Yes.
ma'am. Ma'am, slides are visible.
बस इसका नाम इधर
Okay, so continue with that. Yes, we have to do some pervaginal examination if needed, ultrasound, hysterolaparoscopy, and necessary things what are there should be done for treating the patient. Yes, many a times we forgot about the male factor in BOH like cases, but we have to like look for the male factor, or we have to treat the male factor because शुक्रस्य दोषात् अल्पायु विरूपम गर्भः पतति प्रस्रवते अपि. That means if there is a problem in shukra bija, such type of diseases, virupam, that is anomalies. So such type of disorders happens with the fetus. So we have to check for semen analysis as per Ayurveda. So we have to look for that also. When patient visits us, actually she had faced already 2-3 pregnancy losses, and when she visits us, she may be a very psychologically disturbed case, and that will again add on this pregnancy's outcome. So the counseling is very necessary part in such cases, because it has been found that the incidence of psychiatric illness women following pregnancy loss is about 4 times higher what is seen in general population. That means such a big trauma, psychological trauma she is facing. So counseling part is very much necessary. There may be anxiety, anger, guilt, grief, separation, because in India like country, the conception is regarded as the ultimate expression of femininity. That means if she gives the child to a family, then only she will be called as a Stree. So such a type of social problem is also there in country like India. So she wants a very good healthy child to be handed over to the family, or her husband wants or her family wants like that. So that social pressure is always with her. So the counseling part is very much necessary in such cases. We examine a case, we have taken the detailed history, and with that, if we found a cause, whatever cause is there in present in that lady, then we have to rectify it. The first of all is Nidan Parivarjan. What is the cause? You should be vigilant for that. That means if she is facing IUGR, due to that, afterwards IUGR. I will share one case which is admitted in Sachin General Hospital 3-4 years back when I was working in Pune. So her typical history was first in second trimester she will face a IUGR. She will be diagnosed as IUGR case. Then after that, after 1 month or 6 weeks, that fetus will die in the uterus. And that was when she approached me. That was the 5th pregnancy of such kind. So in that case, she was pregnant at that time. So not much we can do or help her for that, but we have tried all Matra Basti, then Kashmiri Yashti Madhu Kshirapak internally, Garbha Vriddhikar Dravyas, all diet, and yes, Vasanta Kalpa we tried, and up to 32 weeks that fetus was survived. So such type of cases, when we came to know what are the problems there, we have to rectify before pregnancy. So Nidan Parivarjan. In Nidan Parivarjan, we can elevate the doshas with Shodhan Chikitsa if possible, then Shaman, and Apunarbhav. That means the same thing should not be happen repeatedly. That's why there is an importance of Garbhadan Sanskar. Yes, that's why the Acharyas given more emphasis on Garbhadan Sanskar, because the pregnancy should be planned one. Why it is planned one? Because woman should enter the pregnancy in optimal state of the health. That means the mother and the husband also. That means the couple enters in pregnancy with an optimal state of health. And that's why there is importance of Garbhadan Sanskar, whatever told. The preparation of body and mind, Garbhadan Vidhi, and total antenatal care, if we provide, that will elevate the, that will reduce the BOH. We are not aware of that. That's why there are limitations for Garbhadan Sanskar. Many pregnancies are planned and many patients visit us before when the organogenesis is completed. So if there is a repeated history of anomalies, uh, there is nothing left in our hand when patient visits after throughout 3 months of pregnancy. We can't do anything like folic acid deficiency or B12 deficiencies. We can cure before that, or if it is hampering the pregnancy, then we have to supply before it, not after the organogenesis complete. So lack of public awareness, but nowadays with the Garbha Sanskar OPDs or Garbha Sanskar Kendras, the awareness is increasing, and we are fortunate that people are knowing now that pregnancy should be planned and whatever things have to be done, they are doing before pregnancy. So it will definitely reducing the BOH problems. What is there in Garbhadan Sanskar? Yes, appropriate cleaning of the body with Panchakarma, whatever suitable for that couple. Some Vajikaran Ghruta we can, I am telling here what we are giving. There may be many practices which people are following all over India, but I am quoting here what we are giving here or previous institute also. So the preparation by the body cleansing procedures like Panchakarma, Virechan and Basti, I am giving preference to both of them. Vajikaran Ghruta to male partner, Garbhasthapan Ghruta, that means जो गर्भस्थापन औषधि बताई है उससे प्रिपेयर करके घृत फीमेल में दे देते हैं before conception. Proper diet and mode of life that should be followed during the whole course. The planning should be before at least 3 months of pregnancy. 6 months is a ideal time. That means couple should approach you 6 months before the conception. But if we got that much period, then appropriate things we can do with all necessary panchakarmas, Sansarjan Kram and everything, Pachan, Deepan. Almost one karma takes 21 days. So that we can do properly in the patients and the outcome of that is very good. So at least if at
Hello.
आज क्यों क्या हो रहा है?
हेलो
Hello.
मैम प्रेजेंटेशन स्टॉप हो गया?
Yes. It is नेट का इशू आ रहा है. क्या हुआ? Hello.
Yes, ma'am.
Yes, it is establishing now.
Yes, ma'am. It is visible now, ma'am. Okay, ma'am.
Repeatedly here, so sorry for that, I think. So this is the things which I am using for Basti, Palashadi Niruha, Dashamul, Sahacharadi Kashaya, Chatavari, Gudichadi Anuvasan, Baladi Yamak Anuvasan, depending upon, like in Arajas Ka Yoni or Asruja Yoni Shatavari and Baladi Yamak that I am using. Yashti Madhu also. So like that, Priyangvadi Tail Basti also I'm using. So like that, we can change the medicine, whatever the factors, like Rajaska Yoni, Asruja Yoni, Vamini Yoni.
Slides. स्लाइड्स मैम, स्लाइड्स दिख रहे हैं लेकिन वो जो फॉरवर्ड करिएगा आप स्लाइड्स, बिल्कुल फ्रंट पेज दिख रहा है आपका।
ओके ओके ओके, ये देखो फ्रंट पेज क्यों दिख रहा है?
वन पेज
जो सबसे फर्स्ट है वो पेज दिख रहा है।
शो है मैम।
हाँ, वो हटा दो, वो हटा दो।
रिज्यूम शेयर कर, रिज्यूम शेयर तो चल छपले नहीं हुआ था।
F5 प्रेस कर दिए मैम।
यस यस,
F5 प्रेस कर दिए। बस स्लाइड शो हो गया।
ये उत्तर बस्ती है।
हाँ,
इज इट
ठीक
yes
है,
ma'am.
यस मैम,
Now is
इज इट
it?
ओके?
Yes ma'am.
Okay,
यस मैम।
okay. So these are the bastis which I am using. Sthanik chikitsa also you can use for if there is a, if you see the infections or dushti is there in yoni, you can use various type of parisheka. Like in pittaja yoni, you can use the chandanadi taila pichu or sugandhi dravya parisheka. Such type of treatment with the sonic chikitsa you can use pichu, uttarbasti, nasya and dharan also, which is indicated to elevate the garbhopakatakara prabhavas of some things, environmental factors, that also we can advise. So pichu, whatever I am using, Udumbaradi Taila Pichu, Yashtimadu, Nyagrodadi, Sarcharadi, Padmakadi, Shatadauta Gruta and Balatel. So that type of Pichu and Uttar Basti. Chandan Bala Lakshadi Tail is very good to increase the strength of uterus. If the abortions, repeated abortions are there due to the weakness or what you can say, Mausashetilia in uterus, Chandan Bala Lakshadi Tail will be very useful. In some cases like incompetent TOS, there are second trimester abortions repeatedly. So for that we are doing a cervical encirclage. But with that also, if we use the Lakshadita Pichu or Chandanbala Lakshadita Pichu, that will increase the strength. That is my clinical experience. So Pichu of such type you can use. Uttarbasti for to stabilize the uh, this fertile ovum in the uterus. Before pregnancy, you can use the Uttarbasti of Falagruta, Chandanbala Lakshadi. Kashmiri Kutaj, it is specifically described in Asruja and Putragni Yoni, and I am using it since many years, and it is giving a very good result. So Nasya also you can advise with Shatavari Gruta, Brahmi Gruta and Gogruta. Vatashrunga Nasya, yes, it is described, which is described in Pusavana, but Pusavana is for Garbhasthapana also. So Vatashrunga Nasya you can use for Garbhasthapana. And internally Shatavari Gruta, Bruhat Shatavari Gruta, Falagruta, Laghu Falagruta, that you can use internally for fetal outcome to be very good with combination with all other treatments. Shonita Sthapan I am using always in cases of Asruja Yoni like cases. And Prajasthapan you can give to all the cases. Prajavaran Bandha, whatever I said earlier, that yes, Mantra Chikitsa and Prajavarana Bandha to elevate the causes which are Garbhopaghatakara, that you can advise. There is a, if you ask me what is the scientific, whether any published paper is there or what, no. But there is no harm in using it because it might be elevating, which we can we are nowadays we are not able to prove it, but sometimes we can use such things. And mantra chikitsa, yes, faith is very necessary, and the calmness of mind is very necessary for fetal growth. You have to give the advice for the fetus, sorry, for the couple, what to eat and what to not eat. I am not listed all the things here. This is just for example, whatever I have given. But what type of diet she is taking or what type of diet the couple is taking, you have to check that diet, and whatever suggestions has to be given to modify it if it is not suitable for the pregnancy. Then yes, meditation, yoga, and manas chikitsa. And if she is in very anxiety, stress, and psychological symptoms are there, you can use the drug like Brahmi, Jatamansi uh, for mental peace. So such type of things you can advise. There is some asanas which are very useful to maintain the pregnancy. And yes, this asan is very good for preventing abortion. Especially in first and second trimester, you can use as advise such asan during the pregnancy. Yes, this improves the digestion, relieves the constipation, improves the blood pressure also, and prevents accumulation at the lumbar region, fat accumulation. So this can also be advised. So the combination of diet, uh, asanas, pranayam, and medicine, that will definitely help you in treating BOH cases. For mental peace, you can advise Shavasana and Anulom Vilom Pranayam Nadi Shuddhi. Deep breathing and mantra jap also you can use during pregnancy also and before pregnancy also. With all the things, if the patients come with some sort of bleeding like treatment, abortion, if she is aborting, then the treatment, whatever I have earlier said, that we can give the treatment prescribed in Garbhapat or Garbhastrava Chikitsa to for the Garbhasthapan. And I usually use the Yashtimadu Kashai Parishek or cold milk or water avagahan, and then Pichu for Yashtimadu Gruto and Jatyadi Tela Gruto, and Lepa of Shatadauta and Sahasradauta Gruto. That also can be used. The internal treatment during pregnancy, if the signs of abortion you see in the patients, then the Musta, Nagakeshar, Lodra, Guduchi, Yashtimadu, Dhataki, Gairik Rasanjan, such type of drug in combination, permutation, or alone, you can use as per patient's need. Masanumasrik Kasha, yes, they are very useful. Many research papers are published in it for the Masanumasik Kasha and the pregnancy effect of it on pregnancy. Many papers you can see in Google. If you Google it, you can see many papers. So that is also a very safe to use. Treatment of abortion, Garbhapal Ras, everyone I think in India who is practicing in obstetrics using Garbhapal Ras, and it is very good for preventing abortions. But I definitely request you all that use the Garbhapal Ras of very good pharmacy, because now the Rasakalpa, if not prepared very well, then definitely they will create a problem in mother and fetus, and people will blame the Ayurveda science. So use whatever the good material or good market names which are available, or good practices which company is following, use those company drugs. Falagruta, yes, it is very good to continue the pregnancy. Trivanga Bhasma you can use, and Masanumasik Kashan. The other condition which we generally face is IUGR. When patients comes to us for the IUGR, the treatment advice for IUGR is yes, Jivaniya, Bruhaniya, and Vatagna property drugs that should be used internally also, for Basti also, for Kshirapak also, for Siddhajal also, and in every way that is advised to be used. So if IUGR case visits to you, such type of treatment be very useful. Vidari Yashti Madhu Siddhakshir, then Yashti Madhu Kashmiri milk and Sharkara. This is a reference from Vaishajya Ratnavali for the Garbhakshay. That can be used. Madhumalni Vasanta, it is said to be Garbha Vruddhi Karashchasu Garbhaninam Sukhavaha. That means it is very effective in Garbha Vruddhi and it is Sukhakar to Garbhini. So it can be used in Upavishtak or IUGR. The Mudga Masha is very useful. Masha Mudga Yush, you can daily advise to the patient in the breakfast. And Balatel Basti or Shatabri Grita Siddha Basti, Shrimadu Yadarik Vidarik Shira Basti, you can use for the treatment of IUGR. Diet, you should prescribe a very good diet to the patient because it is many a times related to malnutrition or whatever the faulty diet she is taking many a times or mental stress. So both things should be taken care of when you are going to treat the IUGR. Yes, the if we treat this with this treatment, that is giving you increase in birth weight, placental resistance decrease होता है, then amniotic fluid increase होता है, chances of fetal distress कम होते हैं, and decrease in mortality is seen with many researchers with the Ayurveda management in IUGR. So decreased mortality in the fetus, it is seen with the many treatments of IUGR. So with all this, this is a treatment for the BOH cases. What I have covered is recurrent pregnancy losses, mainly because it is a main thing. And yes, if you take care of um, the history of whole patient and the examination and whatever dushti is there, that will be taking care of abortion, multiple abortions, multiple or repeatedly IUDs also, or repeated preterm deliveries also, that definitely will be taken care of. So in these lines you can go with the treatment. I think I have finished with my time. So thank you one and all, and very sorry for repeated disturbances because some things are not in our hand, like internet connection. So sorry for that, and thank you one and all. Thank you participants, and thank you organizers.
Thank you, ma'am. Ma'am, some questions are there. Dr. Narayan Mishra sir, are you there? Okay. Ma'am.
मैम आप होस्ट हम लोग को बना दीजिए वापस प्लीज मेक अ
I have stopped the
Hello.
screen sharing. I think I have stopped the screen sharing.
यस मैम मैम होस्ट वापस कर दीजिए हम लोग को
क्या वापस करूं?
मैम होस्ट होस्ट मेक मी होस्ट मैम अगेन
I have to make you host.
यस मैम
कैसे करना है? नहीं होस्ट बनाना है उनको. It is there in your hands, no? सतीश चंद्र ये
हो चुके मैम मैम कोई मैम हो चुके हैं होस्ट
हो गया मैम.
ओके
हाँ सर
I think Dr. Narayan is not there, no? Or he is there?
Hello.
Hello, Narayan sir.
Hello. Am I audible?
Yes,
Am I audible?
yes, sir.
Yes, sir. You are audible. Yes.
Namaskar, madam. And wish you a very good afternoon, everyone. As you have gone through the topic by the very learned and one of the most humble personality in Prasutitantra, you can see how much experience she is and how much experience she has gathered to share with you. We are really privileged. Ma'am, thank you so much for sharing your experience with us. Now coming to the responsibility that have been assigned to me, regarding the questions that has been put in chat box, there is a very interesting question I can see by Dr. Jagrati Patil. Ma'am, if there is need to bija shuddhi, but there is no state of bahudosh avastha in patient, then what should be done instead of sodhan?
What should be?
What should be done
Instead of shodhan? Okay.
instead of sodhan? Okay.
So you can use the basti, because बस्ती की जो प्रशस्ति है कि बीज को अच्छा
I think the audio has stopped.
and that you can use instead of panchakarma or whatever shodhan.
And the next,
Hello.
Yes, ma'am. And the next question is, how will we deal with the immunological causes of bad obstetric history according to Ayurveda?
What can you repeat?
How will we deal with immunological cause of bad obstetric history according to Ayurveda?
Actually immunological cause जो है उसमें पेशेंट में लक्षण क्या दिख रहे हैं वो तो पहले देखिए, and according to this the presentation of patient we cannot label one thing. So according to the presentation of patient मतलब immunological cause like anti-sperm antibodies से लेके कुछ भी हो सकता है. So presentation क्या है, और अगर अननोन है मतलब मॉडर्न में भी ये सारी चीजें अननोन रहती हैं, तो अननोन है तो जो टिपिकल एक प्रोटोकॉल हमने बनाया है, गो विद दैट एंड दैट विल एलिवेट द कॉज. लाइक योनि शुड बी शुद्ध और गर्भाशय शुड बी शुद्ध, देन देह जो स्त्री शरीर है बहुत हेल्दी स्टेट में चाहिए, गो विद ऑल दोस थिंग्स, so that will definitely elevate slowly whatever the immunological response of that patient, particular patient, that will definitely elevate. If you find out the cause, then you can, yes, use the medicine which are available there for that particular cause.
Thank you so much, ma'am. I think it is very nicely explained by you. And another one question by Dr. Sujata Misra, the role of Mansabha Srotas in bad obstetric history.
यस, मांसभव स्रोतस ये है क्योंकि यूट्रस जो है वो पृथ्वी प्रधान और मांस धातु प्रधान अवयव है शरीर में. जो गर्भाशय है इट इज अ मांस प्रधान अवयव. तो मांस धातु का संहनन अगर अच्छा है तो डेफिनेटली इंटरनल ऑस जो है एंड गर्भाशय है वो बहुत संहनन उसका अच्छा रहेगा. अगर नहीं है, संहनन बहुत अच्छा नहीं है, तो डेफिनेटली वहां भी आपको लूजनेस दिखाई देगा. जो धारण शक्ति है गर्भाशय की, रिपीटेडली अबॉर्शन आपको दिखाई देंगे या प्रीटर्म डिलीवरीज दिखाई देंगे, तो ये धारण शक्ति है जो कम हो गई है मानसिक क्षति की वजह से. तो ये आप लोग सुधार सकते हैं. जो मांस धातु अगर विकृत नहीं है तो मांस की संहनन बढ़ाने के लिए आप ऐसे ड्रग्स दे सकते हो, जैसे कि मीट सूप है वो यूज कीजिए. देन अश्वगंधा लाइक ड्रग्स यू कैन गिव. सो such type of treatment you can, yes, surely use. और मांस का तो है ही, मतलब गर्भाशय तो मांस प्रधान अवयव है ही. एंड जिन्होंने ऑब्स्टेट्रिक प्रैक्टिस की है उनको तो बहुत अच्छे से पता होगा कि इंटरनल ऑस या जो सर्विक्स है उसमें संहनन अगर बहुत अच्छा है, बढ़िया है, देन शॉर्ट सर्विक्स होते हुए भी प्रेगनेंसी एकदम फुल टर्म तक आराम से चली जाती है. तो संहनन बहुत बड़ा रोल है इसमें. मतलब यूट्रस सर्विक्स की लेंथ बहुत बढ़िया है, 3.5 और उसके अबव भी है, बट उसका संहनन बहुत अच्छा नहीं है, स्ट्रेंथ बहुत अच्छी नहीं है. पेशेंट विल एंड अप, यस, श्योरली इन प्रीटर्म डिलीवरीज और प्रेगनेंसी लॉसेस. सो संहनन बहुत काम करता है, तो यस, दैट इज हैविंग श्योरली अ रोल इन इट. तो पूर्ण शरीर का आप संहनन देख लीजिए, उसके हिसाब से आप थोड़ा सा अनुमान लगा लीजिए कि क्या इसका संहनन सही रहेगा. या आपको जब परवजनल एग्जामिनेशन करते हो तभी आपको टोन यूट्रस का पता चलता है. दिस इज अ थिंग ऑफ प्रैक्टिस. मतलब आप 1000 पेशेंट्स के पीवी परवजनल एग्जामिनेशन करोगे तब आपको डिफरेंसेस पता चलेंगे कि yes this is a normal tone, this is a flaccid और this is other type of tone. वेरी हार्ड यूट्रस भी बहुत बार मिलते हैं, जैसे कि रुक्षा योनि में, अरजस्का योनि में बहुत हार्ड यूट्रस भी मिलते हैं. तो आपको स्पर्शन से ही पता चलता है कि इसका सहनन बहुत बढ़िया है या नहीं. जैसे कि आप सर्विक्स में भी अगर फिंगर डालते हो तो उसका जो पैचुलस ऑस है आपको बहुत अच्छे से समझ में आता है अगर आपको प्रैक्टिस है उसकी तो. बट yes you have to be practiced with all these things.
And last question, ma'am, how to deal with the cases of PIH relating to
yes PIH में मुझे लगता है कि yes बहुत सारे केसेस मैंने ट्रीट की है with the help of Ayurveda, not solely with the Ayurveda, because ethical issues are always there with PIH, because there are chances of patient will be going to land in eclampsia or further many complications like up to DIC also. So अगर आप सिर्फ आयुर्वेद से ट्रीट कर रहे हो और पेशेंट को कुछ कॉम्प्लिकेशन हुआ तो इसमें लीगल इश्यूज बहुत ज्यादा आएंगे. So always, in my opinion, always take a Ayurveda treatment or give a Ayurveda treatment as a supportive, not solely, don't treat the patient solely with the Ayurveda, or you should know the limitations of your treatment. Like if the BP is within 140/90 के नीचे है and बहुत ज्यादा एडिमा नहीं है, प्रोटीनूरिया नहीं है, you can treat with if it is in milder form, you can treat with solely with the Ayurveda. But be vigilant. बहुत vigilant रहना पड़ेगा आपको कि कहीं adverse नहीं जा रहा है, और अगर जा रहा है तो interrupt in between. तो जो एडिमा कम करने के लिए बहुत अच्छा योग है जो देवदार शुंठी पुनर्नवा हरितकी, ये योग बहुत अच्छा है जो गर्भिणी में हम लोग दे सकते हैं. And I am using it since many years, and my students are also using, who are practicing all over Maharashtra since many years. So in edema it is very good, but it is not good with the hypertension. Hypertension के लिए बहुत बढ़िया ट्रीटमेंट मुझे अभी तक नहीं मिली एक्चुअली. बाकी लोगों को अगर मिली होगी तो वो शेयर कर सकते हैं. बट यस एडिमा इससे कम हो जाता है, बीपी थोड़ी लेवल तक कम हो जाता है, बट नॉट very drastically. You can reduce with the treatment. So yes, you should know your limitations surely when you are going to treat such critical cases or such complications during pregnancy.
Of course, ma'am. Another question from Dr. Hriday: how to deal with the cases of fungal infection in pregnancy? Can Piflaquat be used?
इंटरनली आप थोड़ा प्रिकॉशंस लो जो भी ट्रीटमेंट दे रहे हो. एक्सटर्नली यू कैन यूज एनीथिंग एक्सेप्ट विषद्रव्याज कुछ होते हैं वो आप यूज मत कीजिए. जैसे कि बहुत सारे इसमें मंशील होता है जो एंटी फंगल क्रीम्स है उसमें. सो सच टाइप ऑफ क्रीम्स यू शुड नॉट यूज. बट yes, herbal drugs you can externally use very well. Piflaquat you can use externally very well, no issues in that. But internally आपको प्रिकॉशंस बहुत ज्यादा लेनी पड़ेंगी. क्या इस्तेमाल कर रहे हो आप? लाइक मंजिष्ठा लाइक ड्रग यू कैन गिव, बट एक्सटर्नली आल्सो यू कैन यूज एनी मेडिसिन विदाउट एनी विषद्रव्यस. दैट्स इट.
बोलना वो सेमिनार चल रहा है.
And hello. Yes.
सर या सर लास्ट क्वेश्चन अब हम लेते हैं, बाद में और कर लेंगे.
बिल्कुल मैडम.
Yes, I think many questions होंगे क्योंकि obstetric में थोड़े बहुत yes होते हैं. So I am available on phone or whatever things available for the communication. No issues in that.
सर आप लास्ट क्वेश्चन पूछ लीजिए.
Yes, ma'am. With your permission, this is the last question. How to deal cases of AMH deficiency?
AMH?
Deficiency.
AMH deficiency. Actually, this is not related to the topic.
Not related.
Yeah.
Not related.
Yes.
Yeah.
AMH deficiency, yes. Ovarian reservoir हम लोग बढ़ा सकते हैं क्या आयुर्वेद ट्रीटमेंट से? देखिए जितने ओवम आए हैं बाय बर्थ, उसके साथ में, उस लेडी के साथ जितने ओवम आए हैं उतने ही रहेंगे, उसकी संख्या हम लोग नहीं बढ़ा सकते, बट यस, quality of the ovum or whatever cells are there in the ovaries or the function of ovary, yes, we can surely increase with our medicines. And yes, for that you can use various bastis and internal medicines, whatever the condition of the patient, like what is her age, whether she is near the menopause or what is the childbearing age she is having, and whether she want to conceive, and what are the levels according to that, what time period you are having, use vigorous treatment or some mild treatments, you can choose according to whatever the need of patient. But yes, AMH levels we can increase with our treatment, internal medicines and basti, surely. This is my experience.
Thank you so much, ma'am. It's really my privilege.
Thank you, ma'am.
Thanks a lot,
I'm
and sorry once again for disturbances. Thank you.
No, ma'am,
Thank you,
thanks.
thank you, thank you.
Thanks a lot, ma'am.
Thank you.
Now it is over to Dr.
So
Sujata
shall we
Samkumar,
start
ma'am.
second session? Okay, so thank you. So a warm welcome to Dr. Ashokan sir, who is our second guest speaker. He is professor and head of the Department of Prasutitantra and Stree Rog at Parul Institute of Ayurveda, Parul University, Vadodara, Gujarat. Sir possesses an experience of 14 years in UG teaching and 9 years in PG teaching. He is also a PhD guide. He has attended many national and international seminars and presents scientific papers on clinical studies. He has won many prizes and awards since undergraduation till date. Sir has also been a resource person for more than 18 national and international webinars during the lockdown period. His areas of interest are gynecological, antenatal, and postnatal care. He has published more than 30 scientific articles in international journals. Safe motherhood by providing good antenatal care is very important to reduce maternal mortality ratio and infant mortality rate, and to achieve Millennium Development Goals also, to overcome hazards during pregnancy and to keep her vitals pure. As Stalwarts describes Antarvartini Paricharya. I request Dr. Ashokan sir to share his knowledge and vision about this concept. Over to you, sir. Ashokan sir. Ashokan sir.
Am I audible?
Yes, sir. Yes,
Yes,
sir.
sir.
But I am able to speak through my mobile, but not through the laptop which I have connected with the PPT.
Okay, sir.
Screen
Sir,
sharing
actually,
option has.
Sir, you can share the PPT, sir. Now you are host. Hello.
Yeah, I'm trying. Is it visible?
Yes, sir. Yeah, no, sir. No.
The screen which you have shared is not showing any option for sharing the screen.
सर सर शेयर में मोबाइल में आप चला रहे हैं?
मोबाइल ऐप में तो है।
सर आप मोबाइल में एक शेयर स्क्रीन का ऑप्शन होगा, उस पर आप क्लिक करेंगे तो आप स्क्रीन को वो कर सकते हैं, डॉक्यूमेंट्स में जाइएगा, स्क्रीन शेयर पर क्लिक कीजिएगा, डॉक्यूमेंट एक ऑप्शन देगा, उसमें देखिए आपको मिल जाएगा।
ओके।
ये सर जुड़ नहीं पा रहे, जुड़ चुके हैं, वो स्क्रीन शेयर कर पा रहे, स्क्रीन नहीं दिख पा रहे, वो कर रहा है कैसे कर रहे हैं?
Yeah, I think.
हो गया।
Huh. Sir, it is visible now, sir?
Yes, sir. Now is visible.
Yeah, now is it visible?
Yes, sir. Yes, sir. So you can continue, sir.
Shall I start?
Yes, sir.
Yes, sir.
Okay.
अपना वीडियो पर स्टॉप कर दीजिए।
Very good evening.
अपना वॉल्यूम तो बंद है मैडम, आप बोल।
Hello.
Yes, yes, sir.
Yeah. Very good evening to respected principal sir of both the colleges. Namaste to you, sir, and also the departmental staff and the other government officials who have invited me part of this webinar series on antenatal care and underworking paripreksha. I am indebted to you for this opportunity, as well as I would like to share my views on the antenatal care which is told in the classics, as well as the various therapeutic procedures which are mentioned in Ayurveda for the purpose of improvising the maternal health and assessment in the antenatal period. So, hello.
Yes, sir.
Sir, you are audible, sir.
So, what is ANC? A part of it has been dealt by the Sujata madam, and she has imparted a vast topic of BOH, wherein the systematic supervision, that is, which incorporates the examination and the advice of a woman during pregnancy, is called antenatal or prenatal care. The prenatal care is the care that starts before pregnancy and ends at delivery and during the postpartum period, as we know. So the antenatal care comprises of the careful history taking and examination, that is a general as well as the obstetrical origin. The aim and objective we know is to screen the high-risk cases, to ensure continued risk management assessment, and to provide ongoing primary preventive health care, to educate the mother about the physiology of pregnancy and labor, which is very important in the management of ANC care. Because whenever there is anxiety during pregnancy regarding the outcome of pregnancy, what will happen to me, what are the various physiological changes which are occurring to a pregnant woman, which she is unaware in primi gravida. So that to educate and to impart the knowledge of physiological changes during pregnancy in a layman's world or into an educated society is very significant. Then to discuss the couple about the place, time, and mode of delivery. So the mode of delivery, place and time, when they should come to hospital, and on visualization or elicitation of what symptoms and signs they should approach the doctor. So these are very significant to avoid a majority of the practical problems which we come across as in patient coming in late first stage of labor to the hospital, and the delivery may need to be done conducted in an auto rickshaw or maybe in a car or maybe in a transportation vehicle with which the patient had come. We come across this condition of place, time, and mode of delivery to motivate the couple about the need of family planning and also appropriate advice to couple seeking medical termination of pregnancy. And the primary objective is to ensure a normal pregnancy with the delivery of healthy baby from a healthy mother. Is it echoing? Is it echoing? No. So the first visit or the first antenatal visit, what it should incorporate is as early as possible. A woman should be encouraged to visit the hospital because she may not be knowing in a village, and India is having villages and India lives in village. So that was the vision which our father of nation has imparted to us, and we can see the same situation even after these many years of independence, that people at village limits, they lack the first visit to hospital. It will be around 6 months, 8 months, etc. So this has to be taken care of. Though we say we are very developed and far developed and we have prevented maternal morbidity and mortality, still in villages we have these problems. Then objectives to assess the health status of the mother and the fetus, to assess the fetal gestational age and to obtain the baseline investigations, to organize continued obstetric care and risk assessment. So these objectives to the world is very significant, and this we can know the importance of these objectives if we travel different places and we visit different as these objectives are yet to be fulfilled, though we are planned these objectives well in advance. So what is the significance of a history taking in an obstetrical condition? A pregnant woman comes to you, or she is not diagnosed as pregnant with a period of amenorrhea, she may approach you with history of 2 months or 1.5 months or first missed period. So there are various conditions which we need to know, and if we are able to take the history proper in the first visit or in the subsequent second visit, at least complete the history taking, then we will be able to give justice to the patient, know the prakriti, vikriti, sara, samhanana, etc. of the patient. Thus, we will be able to know the bad obstetrical history, if any, and any history of recurrent abortion, preterm deliveries running in the families. My mother also had, the patient will say, my mother also, my sister also delivered in the 7th month, completed 7th month, in the 8th month. So this history runs in family. So there may be a tendency. I'm not telling that it will be there. So this we have to take in detail in the gravidity status as well as the parity status and the previous childbirth, nature of childbirth, etc. So a detailed history taking, including that of menstrual history, madam has explained very well. And the past medical and surgical history also keeps an equal importance while eliciting the details of an ANC case. And the family history also need to be noted very detailedly, because there may be patients who are having history of pox infection in the family, because of which there may be a possibility of complications in the pregnancy period because of the infection. So this family history plays a vital role, as well as thyroid dysfunctions in running in the family, the diabetes mellitus, hypertensive disorders, and nowadays we have to take the history of polycystic ovaries also, because we have reached the a stage where there could be a positive family history of polycystic ovaries, treatment history, wherein the woman might have conceived and the child has grown up and now she is at the verge of conception or the further ANC care. So family history should incorporate all non-communicable disorders, communicable disorders, as well as various gynecological and obstetrical ailments. Then coming to the examination, we need to know the build and height and weight of the patient. So short stature, always we know we may get a CPD proportionate to the fetal outcome. So then the weight gain during the pregnancy is very significant to note. The weight gain during the pregnancy and jaundice, neck, as well as the pulsation, radial artery pulsation, etc. and pallor. Coming to the pallor, we simply say +1, +2, +3, we put and go, neglect many a times, but no, we should not in practice. Why? Anemia in pregnancy is still till date a great health hazard in Indian women. So especially during the ANC period. So we need to take care of the anemia, which we are evident by the pallor. So the next condition which we need to give importance is to untreated tooth disorders or tooth ailments, then tonsils or any other complaints regarding to the coating of the tongue, etc. Edema of the legs. So pre-existing edema prior to 5th month of gestation. So that we need to monitor. And if a patient is hypertensive, so that also non-hypertensive now in conception should also be noted. And nowhere there is a less importance to the breast examination during the history evaluation. Early, once in the first trimester, when the woman may feel tenderness in the or soreness of the nipple and tenderness in the nipples, as well as the breast, that needs to be counseled. And she should be advised about the changes, physiological changes in the breast development or the changes during the pregnancy, following which she should be advised to take supportive measures of clothing, which helps us to relieve the tenderness in the breast. And the person or the individual or the woman should be trained to manipulate the nipples so that there will not be any the problem with the inverted or eversion of the nipples are essential. So inverted nipples and cracked nipples can be prevented after the childbirth process. So once the child is born, the child is put on the mother's chest and breast, then we are diagnosing that there is a sore nipple. So than diagnosing it then and there, we can diagnose in the late pregnancy, that is in the 3rd trimester period. So around 36 weeks of gestation. Then obstetrical examination, as we all know, I'm just brushing up through these topics because we know it. Why and what is the significance that we need to understand, and we are recollecting what we have learned over the years. So abdominal examination, tone of the abdominal muscles, presence of any incisional scar or presence of herniation, skin condition of the abdomen are to be looked for. Then fundus of the uterus is just palpable over the symphysis pubis at 12 weeks, and the periodic growth of the fundus should be elicited, as in cases with IUDR or in polyhydramnios, oligohydramnios, etc., or in twin pregnancy. Then vaginal examination is done in the antenatal clinic first time before the 12th week to diagnose the pregnancy and to corroborate the size of the uterus with the period of amenorrhea and the period of and to exclude any pelvic pathology. Then coming to the investigations, as we know, many of us, even in government sector, the first and foremost visit itself or in the second visit itself, the routine and the specific investigations which are needed in the hematological parameters like hemoglobin, hematocrit values, then ABO, RH grouping and typing, then VDRL and HIV, HbSAg, these are done. Then blood glucose and the antibody screening are done in selected cases. Urine routine is done to diagnose the ketoacidosis in nausea and vomiting or excessive hyperemesis gravidarum. In conditions like hyperemesis gravidarum, the presence of ketone bodies And in the second trimester, to note down if there is any dysuria and pus cells along with Upapluta univapat, we need to know about the presence of pus cells, that is urinary tract infection, in the late second trimester as well as in the third trimester, which may be one of the cause for preterm onset of labor pains, or else there may be premature contractions. So UTI, so need to be ruled out. Then this investigations we need to do periodically when and where necessary, and the routine investigation should be done in the first trimester. Then serological tests include the rubella, hepatitis B virus and HIV, then the genetic screening for maternal serum alpha fetoprotein, and the triple test at 15 to 18 weeks in consanguineous marriages, as well as those who are suspicious of previous history of congenital malformations in the fetus wherein the termination was done. Then ultrasound examination should be done in the first trimester once, trans-abdominal. Preferably TVS transvaginal is done in the first trimester. And the target scan is done around the 18 to 20 weeks of gestation to find out the congenital malformations if any. Then the nuchal translucency can also be knuckle translucency as well as in nose, the tip of the nose. So the nasal bridge or the bone can also be diagnosed as early as 13th week of gestation. Then repetition of the investigations, the ultrasound examination in the second and third trimester. Third trimester is around 36 completed weeks we need to go, and various parameters which are essentially to be known, like the cervical canal length or the fetal growth and IUGR, differentiation of symmetrical, asymmetrical IUGRs, etc. can be done. And the amniotic fluid index is a very significant parameter for us to diagnose through ultrasonography. And various others are also there, like Doppler ultrasound scanning and diastolic notching and its monitoring, etc. to find out Upavishtaka, Nagodara, etc. Then repetition of the investigations may be done, like hemoglobin estimation at 28th week and 36th week, and if the patient is non-anemic, if not anemic. Then urine is tested with the dipstick for proteins and sugar at every antenatal visits. So we know, all of us, we know about the frequencies of planning of subsequent visits. So WHO says that as less as a minimum of 4 visits are essential. So we do even up to 8 visits. So interval of 4 weeks up to 28 weeks, once in a month, that is, and an interval of 2 weeks up to 36 weeks, and thereafter weekly till delivery. So this we know from the first visit of the patient. Then the objectives, we know the fundal height examination, isn't it? So objectives is to assess the fetal well-being, the light, presentation, position, and number of fetuses in case of twin pregnancy or multi-fetal gestation. So we know Ayurveda has mentioned about Yamalagarbha, that is twin pregnancy, and Bahupatyata by Vagbhata. So when we were students, we thought that Ayurveda is full of controversies. Is it so? No. Ayurveda is not. The difference of opinion of Acharyas is about Yamala Garbhotpatti is about twin pregnancy, whereas Vagbhata's opinion says that Bahupatyata is of multi-fetal gestation. They were very clear. Each author mentioned contributed differently. So there is no difference of opinion. There is difference of observation, clinical observations, which are made by our Acharyas. Then anemia, preeclampsia, amniotic fluid volume, and fetal growth can be monitored. To organize specialist antenatal clinics for patients with problems like cardiac disease and diabetes, to select time for ultrasonography, amniocentesis, or coronavirus villus sampling if needed. Then examination like a general weight, pallor, edema of the legs, and blood pressure can be done. In addition to which, abdominal examination, which includes inspection for abdominal enlargement, pregnancy marks like striae gravidera, linea nigra, etc. And we have a vast research works done on Kikisa. So every Ayurveda drug is found to be, many of the Ayurveda drugs which are mentioned in the context of Kikisa They're found to be highly beneficial, and nowadays the modification in the pharmaceutical drug delivery system is the next step of development in the Kikisahara, as the thylas are modified into gel, ointment, malaharas, etc. Then surgical scar, then midline and suprapubic. So these are to be monitored on inspection. And Ayurveda has contributed that, saying that Vama Parsha Unnati, Dakshina Parsha Unnati, Dvaya Unnama, Ukshit Dvaya Unnama, that is both sides are elevated, and Droni Bhutam in the middle is a sign of twin pregnancy. So these are the contributions where and where. So Matustu Prishta Vimutaha, Sankuchita Anganyaste, Anta Kukshau, so universal flexion is told, attitude of the fetus is told in Ayurveda. So wherever there is a relevant Ayurvedic literature available, it should be made aware to the student at teacher-learner level, and the clinician should practice. When he is practicing, he should show his PG scholar, or the practitioner should know that these things are to be remembered in Ayurveda also. Sayonim shirasa yati sabhavat prasavam prati. So Prasuti Maruta Yoga Parivratya Avakshira Nishkramatya Patyapatena. So these things are mentioned in Ayurveda regarding the cephalic and the podalic presentations. Next. The first of the initial visit should be made as early as the pregnancy is detected. Then, what are the parameters which we should know in case of risk patient? Include fetal kick count. So we can ask the patient the fetal well-being. Why we advise ultrasonography? The indication says that fetal well-being, FWB. So fetal well-being is the indication for ultrasonography. So kick count 10 in 12 hours. 9 o'clock patient came to you. We're monitoring the patient, asking the patient to count the kicks for next 12 hours, either in the hospital, taking rest. If the patient came with the complaint of some loss of fetal movements, or not feeling the fetal movements or kicks, then cardiac technique includes 10 in 12 hours. That is also same way, but the patient should take adequate rest and recumbent posture. The cardiac technique is used. Whereas in Sadowski's technique, 4th hourly and after having something food, suppose the woman is starving overnight, then the fetal movements may be retarded. So we need to give some nutritious fluid, juices, fruit juices, or some liquid foods, Yavagu Kalpanas. Then we should elicit at the end of 1 hour, 2 hours, and 4th hour. If 4 movements are elicited, it is a positive index for the active fetal movements. Then non-stress test, which we know. So I am not going into the detail of it. FHR should be at an 120 to 160 range beats per minute, and reactive and non-reactive test. If it is non-reactive, then we go with the contraction stress test. So either by nipple stimulation or by IV oxytocin drips, uteroplacental insufficiency can be earlier diagnosed and early management will be possible. So pre-contraction in 1 minute, duration of 10 minutes. Then sonographic assessment of fetal behavior or amniotic fluid volume. Then earlier I had mentioned about the umbilical Doppler velocimetry, wherein we can trace the flow rate, and Ponderal index level also will indicate the fetal blood circulation, and the hypoxia can be early detected in the fetus. The hypoxic level can be detected earlier in the fetus. Then 10 to 12 weeks of chorionics villus sampling if needed. Then 15 to 18 weeks ultrasonography, as well as a triple test if special investigations are needed. Then amniocentesis if needed. Then coming to the palpation, to note the height of the fundus above the symphysis pubis, and also to measure the symphysis pubic fundal height, which corresponds beyond 24th week up till 36th week to the period of amenorrhea in centimeters. Then the second trimester, to identify the fetus by external ballotment, fetal movements, palpation of the fetal heart, and auscultation of the fetal heart sounds. In the third trimester, abdominal palpation will help to identify the fetal height, presentation, position, growth pattern, volume of the liquor, and also any abnormality. My guide used to guide me, saying that just by looking at and palpating, you should be able to tell approximate fetal weight, estimated fetal weight, not by ultrasonography. Then we will go with ultrasonography to clinically develop our skill. So how to develop our skill? Repeatedly examining and assuming Anumana Jnaya Bhava. Anumana Pramana, we are applying saying that this may be around 2.5 to 3. Then estimated fetal weight we will assess through ultrasonography by various parameters of abdominal circumference and fetal femoral length, the ratios. Then we will be able to say that this is the my Anumana was correct or not. The examination also helps to detect whether the presenting part is engaged or not. And this maneuver between the teacher and the student also helps, or a clinician also helps to bring up a rapport between the teacher and the student, as well as the patient and the consultant, right? Then measuring the cervical dilatation in the active labor cases like vaginal examination in the later months of pregnancy beyond 37 weeks with an idea to assess the pelvis. Pelvic assessment is best done with the onset of labor or just before the induction of labor. Any history of vaginal bleeding contraindicates vaginal examination. So patient prior to the term, if there is any bleeding, then we should be cautious while doing the pelvic examination. We can take an hour on pelvic examination. So health tips during the first trimester. So I'm not going to read. So these are some of the health related issues with the patient may come to your clinic presenting with. So she is unaware of her physiological changes during pregnancy, breast tenderness, nausea, vomiting, gain, etc. So patient should be monitored first of all. Then later on, the hygienic practices should be advised to her. Preventive care be advised to her. Primary preventive care, nutritive supplementation, diet and regimen should be advised to her. Tips regarding traveling, the coital activity, and the exertional routine activity atmosphere should be advised to the patient. Then these are some of the common disorders, discomforts we can say in pregnancy period, and their causes and the remedial measures. Then nausea and vomiting. So we have a vast group of drugs which can prevent the nausea and vomiting, which are amapachaka, and vatanolomaka. So we can give fruit juices like Dadimas Varasa, then Mandapeya, Ushna, Sukhoshna Laja Mandapeya. Then we can give various other liquid Yavagu, Mulaka Yosha, etc., which are feasible during pregnancy period. Also, mouth and chewing the Munakka or Sukha Draksha will also be helpful. And Draksha is also one among the Upaga Dravyas for in many conditions. So they are helpful in such a Trishna Nigrahana. So these are helpful, Shramahara Dashemani. So these are helpful in pregnant women also. And we are giving Rasayana Churna, which I have come across during my study period. And Rasayana Churna, along with the Draksha when advised, it prevents to majority of the extent the nausea and vomiting during pregnancy. Then, so we have various other conditions like leukorrhea, hygienic conditions should be maintained. Hyperacidity we can overcome just by advising not the medicines, but by advising citrus fruits intake and avoid overeating at a time and breaking up the meal and spicy foods, avoiding the excessive use of spicy foods. So these are things which we can do. So we know what are the values of antenatal care. What is ANC in Ayurveda? So Ayurveda, does it begins with pregnancy? No. The Garbhini Paricharya or Antarvatni Chikitsa, Antarvatni Paricharya. Antarvatni is a term coined and contributed by Acharya Kashyapa, who is an expert in the field of Prasutitantra. So he has told that Garbhopakrama Vijnanam Sutikopakramam Tata Balanam Rogashamani Kriya Bala Chikitsitam. In addition to that, Ayurveda has all the Acharyas have contributed preconceptional care. The exclusive contribution of Ayurveda, right from the choice of couples, the age for marriage, that is Vivaha Samskara, then method of conception, Garbhadana Vidhi, and prior to the Garbhadana Vidhi, the advice of Shodhana Karma. So these have given an apt indication of Shreyasi Praja or Supraja in Ayurveda for preconceptional care before the Garbhadana Vidhi. So selection of couples also helps us to avoid the consanguineous marriages. Also in Ayurveda has been mentioned. Then, so it is mentioned as Atulya Gotriya. So the concept is different, Atulya Gotriya. The terminologies are different, but the science behind it is the same. So antenatal care is mentioned in Ayurveda as Garbhini Paricharya. So we have preconceptional, method of conception and care, and Pumsavana, and antenatal care and Garbhini Paricharya in Ayurveda. So what are needed? Shodhana we know from Mamanadi Karma till Uttarabasti can be practiced for Bija Shuddhi and Kshetra Shuddhi. Then Putriya Vidhi and Putreshti Yajna are the difference of opinion of different acharyas, which is to be done during the preconception period. Then the act of conjugal ceremony, that is a coital act, itself has been elaborated saying that Oja Yugma Divana, Dina, etc. So these have contributed, are the contributions of Ayurveda. And Pumsavana with the three purposes. When at the outset we say Pumsavana, there may be a contradictory statement, sex bifurcation or gender discrimination. No, it is not like that. So it is before conception, at conception for continuing the pregnancy and the care of the pregnancy, that is the fetus, and later comes the gender discrimination or differentiation selection criteria as Pumsavana. So the third one is barred. So rest of the two we can do. Method of conception, that is a Garbhadana Vistara. So Ritu, Kshetra, Ambu and Bija. We know all the four and the importance of the four, that is Ritu, Ganaya Rajasravakalaha, then Kshetram Garbhashayam, endometrial factors and the uterine factors and the cervical factors responsible for the fertility. And the Ambu is the nutritive factor and the rasa of the male as well as the female, especially Ambu we consider in female. And Bija is Artava and Shukra. So the importance which the Sujata madam also highlighted, Shukra Dushti leading to premature labor, Nachasya Jayate Garbhaha Patati Prasvatyapi. There may be Vandyatva. If conceived, there may be recurrent abortions or early trimester abortions or miscarriages. Later on, there may be preterm birth or Vikalendriyova, Vigunova, so congenital anomalies, and premature delivery. So these are the factors which are attributed to the Shukra Gatavata Lakshana. If we analyze, we will get these references like Shipram Munchadi Badnati, Shukram Garbhamatapiva. So Garbhamatapiva is being explained. Then normal posture for coitus is also highlighted in Ayurveda regarding the man on top with supine posture. Then for normalcy of the doshas, days of coital act for male and female baby to achieve the desired child is also mentioned. Antarvartini Paricharya is mentioned in the categorization of Ahara, Vihara, Vichara, etc. Then Aushadha. So later on, Aushadha is mentioned. So Ayurveda has told that first 3 months or during pregnancy, Aushadha to be restricted. So it should be in the mode of dietary modalities. So Samanya Chikitsa with the congenial diet, palatable food, etc. are being mentioned. We know if we go and analyze, we see majoritically, we can see that there is no other diet than milk and ghee. So it is Nehayoni. So and it is Satmya to the every person. So it is predominantly mentioned. In addition to that, according to the Dauhrada, we can select the other dietary materials. And code of conducts. So how to be, how not to be. So what to be done, what not to be done. Suppression of urges, suppression of Dauhrada. So non-wearing of clean garments, wearing of very tight-fitting garments, usage of mobiles we can add nowadays, looking at the places which are fearful, or these depicts the nature of the fetus and the consequences on the fetus. Then specific water for bath is also being mentioned. Then this is a charya which is mentioned in the Masanumasika Paricharya in Ayurveda. So I will go through only the benefit of it. What if done? So it will help in Vatanalomana, growth and development of the fetus, nutritional supplementation to the mother, and Vatamutra Purisham Margamanuvartate, and the body becomes supple and it develops the ability to bear the labor process, as well as the mrudu bhavati, even up to the asti nakhas are getting, nakha is getting karma and nakha are getting mrudutva, means the asti also is samyak snigdha. So the dhatus are in samyak snigdha avastha, so there will not be any vata janita vikruti. Balavarna upachaya and kalena sukhena prajayate, kale sukhena prajayate. So this is the benefit of asana masika garphini paricharya. So we know what can be given. So here is a list which I have prepared. So we can prepare our own list according to the availability and desha and kala. And some of the yogasanas which are practiced are being elicited and enumerated here. So why we have to give asana masika paricharya is being explained here. In addition to which, the 6th, 7th month, it is being Gokshra and Pratak Paranyadi Siddha Gruta is being told. So these are also helpful in relieving the physiological pedal edema, which may be postural also in case of non-pathological conditions. So we can use these modalities. So how it helps is being told in these slides. Then the various yogasanas I have mentioned in this chart, which are useful. And in the 8th month, the beginning commencement of the 9th month, from the entry into the Sutikagara, Anuvasana Basti or Matra Basti and Basti Chikitsa is indicated, as well as the Yoni Pichutharana is indicated for enabling Sukha Prasava. So these are some of the treatment modalities, and Marjari Asana, these asanas have been shown to you in the previous presenter. And this is the second schedule of Yogasana with the time duration. This we are practicing here. So for the purpose of antenatal care through Ayurveda, wherein we are advising this has been taken directly with some modification from the Government of India, the advised chart for yoga schedule during pregnant women. Yoga in pregnancy, there is one PDF available. So from there we have copied it. So Tadasana, Vrikshasana. So the postural variation, standing postures, then coming to the sitting postures, then go to the lie down postures, supine, then go to the prone postures, then come again back to the pranayama sessions, then meditation, then deep relaxation techniques like Shavasana, modified Shavasana. So this is how systematically we can travel with the pregnant woman for enabling her to energize herself, to know her potency herself, and to relieve her the pathological conditions like low backache, tension, anxiety, worries, etc. At the same time, it relaxes the pelvic floor musculature and enables the woman to go with the normal vaginal delivery at term. So these are some of the practices. This is the pic depicting all those what I have put there. So another point in Garbha Sanskara nowadays is very popular is creative visualization. So the patient is predominant sceneries, as well as Garbha Samvada, talking between the mother and the fetus, not the doctor and the fetus. It is the mother and the fetus. So Garbha Samvada is the special art of communicating with the unborn fetus in the womb, and it is about developing a child of desired qualities. That is imparting good sanskaras in the Garbha from the intrauterine life itself in order to promote the healthy citizen development from the womb. So coming to the conclusion, we can say that careful history taking, a thorough clinical examination, including general and obstetric, investigation of routine and specific, advices of diet, hygiene and specific to any problem during pregnancy, appropriate visits during pregnancy, then monitoring the maternal health, weight gain during pregnancy, vitals monitoring, pallor, then symptom analysis of nausea, dysuria, etc., and other any abnormalities, and identification of the health high risk factors early in the pregnancy. Then fetal health like fetal growth, fundal height, fetal heart rate, amniotic fluid volume, presentation and fetal activity, couple education regarding the family planning techniques, nature and termination and mode of delivery, the care during pregnancy, Bhartra, Bhutyeshcha Garbhadra, Upachara. So once you are pregnant, I will go and travel and come. So that will not do. So couple education is needed, counseling and advice. Then preparation for childbirth, that is couple is informed about the labor course, delivery, need for operation if any, anesthesia and the complications possible if any. So these are some of the references which I have to quote. And this is one of the great saying by our Bharat Ratna, APJ Abdul Kalam ji. What does he say? Birthday, according to him, is the only day in your life your mother smiled when you cried. So thank you one and all. If I have done any mistakes or my language was big problem for you, kindly pardon me for the same. Thank you one and all. Hello.
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 Hello, Narayan sir, is there?
Am I audible, ma'am?
Okay, sir. Yes, sir.
Yes,
कुछ
ma'am.
हिंदी में बोलना था और कुछ बोलना है, कुछ क्वेश्चंस है तो उसमें हिंदी में बोल देंगे. शायद कुछ अंग्रेजी में ही चला गया सब कुछ. मैं भूल गया. मुझे एक वार्निंग भी मिला था कि थोड़ा हिंदी भी बात किया कीजिए ताकि हेल्पफुल रहेगा.
Absolutely no problem, sir. बहुत इंफॉर्मेटिव और एलैबोरेटेडली आपने एनसी केयर बताया है. मेरे हिसाब से जितने भी क्वेश्चंस हैं उसमें मुझे कम नंबर ऑफ क्वेश्चन. सबसे पहला क्वेश्चन, फर्स्ट क्वेश्चन फ्रॉम जागृति पाटिल जी, हाउ टू डील विथ किक केस.
Sir, I didn't get your question.
Dr. Asokan, are you getting?
Yeah, I didn't get your question. I heard only kickis.
Okay, how to deal with kick case? Dr. Jagrati Patil has asked the question.
It is a stretch mark. It's a very interesting question. So various studies have been done and materials are uploaded in the internet. You can Google it. Also, one more thing is that kick case is a stretch mark. So it is a stretch and the skin changes which are occurring is due to the stretching, and the stretch marks are not only restricted to the stretch marks are not only restricted to the pregnancy period. It may be if suddenly a person gained weight, then also the person may get stretch marks over the ankle, over the nape of neck, axilla, as well as the thigh folds. So in Ayurveda, Kitkisa, the word is used in relation to the stretch marks, and Ayurveda says that it is due to the growth and development of the fetal hair. So if we consider all this, we can say that it is a Savarnikarana Chikitsa. So we have to manage it through Savarnikarana Chikitsa, which is told in Ayurveda. So Savarnikarana Artha, we have Karavira Taila, Chandanadi Taila, we have various formulations for that. So we can use these formulations accordingly as a labor. That is, it act on the Bhrajaka Pitta. They act on the Bhrajaka Pitta, Twadgata Bhrajaka Pitta. Thus, they relax the keratin breakdown or keratinization and the pigmentation changes. And I have seen that by proper application for a prolonged period, even if we are giving in a preventive care, we can give the Ayurvedic medicine in two ways. One is through preventive care in Kikisa before the manifestation of Kikisa, as well as after the manifestation of Kikisa as a curative measure. So if we give before the manifestation, for example, if we start it at around 20 weeks of gestation, before the abdomen starts stretching up due to the fundal height, that will be up till 26 or 30 weeks, 26 weeks, it will be preventive care. Later on, if we give, it will be therapeutic care. So we have various formulations which are mentioned in Ayurveda, and they see that we are not applying any Shasha Rudira. So Shasha Rudira is also mentioned there. We are not going to kill the animal to apply it. We have Chandana Taila. We have ample number of cosmetic drugs from Haridra, Kumari, We have ample Vanjishta, Yashti Madhu, Lodhra. We can prepare one combination of ours and we can use. And we have studied recently, one of my student here in Parul has studied on the use of roller. It was prepared as a roller and it was applied. It has got very good result. In addition to that of disappearing of the kikisa, there is an added effect of enhanced flow of the abdomen. So this is the finding. Hope I have justified your question.
Yes, thank you so much. And we are getting number of compliments rather than the questions. And one one more question, sir, regarding the double marker, triple marker, and quadruple marker tests.
Yes.
To be advised to the pregnant woman.
Yeah. It is, as I told, in between 15th to 18th week of gestation. If there is a history of consanguineous marriage, then we can go with. If there is a past history of recurrent abortion or hydroxpitalis or any relevant history in the past, then we can definitely go with these tests. So they are not a routine one, but we can go with them if there is a need.
Thank you so much, sir. And Dr. Sujata Samkumar ma'am, the questions are, I think, over now. And I would like to request you to please continue with the session. And
thank you, Narayan sir. And thank you, Dr. Ashokan sir, for this wonderful session. Now, this session is over to Dr. Pankaj Mishra sir. Sir, over to you.
थैंक यू मैडम.
Thank you so much, sir.
मैं यहाँ पर उपस्थित विषय विशेषज्ञों का विशेष रूप से धन्यवाद देना चाहूंगा, जिन्होंने इतने महत्वपूर्ण विषय पर अपना व्याख्यान प्रस्तुत किया. मैं सहृदय से आभारी हूं आप सभी का. इस वेबिनार की जो कल्पना है और जो जिनके अनुभव के बिना, जिनके सहयोग के बिना और जिनके मार्गदर्शन के बिना पूर्ण नहीं हो सकती थी, ऐसे हमारे प्रधानाचार्य शासकीय आयुर्वेद महाविद्यालय इंदौर के प्रधानाचार्य डॉक्टर सतीश चंद्र शर्मा सर को मैं सादर आमंत्रित करता हूं. वे आए और वोट ऑफ थैंक्स. डॉक्टर सतीश चंद्र शर्मा सर.
हेलो, कैन आई ऑडिबल?
यस सर.
हाँ. आज के वेबिनार में सर्वप्रथम माननीय मंत्री जी रामकिशोर कांवरे जी, जिनके इनिशिएशन, प्रेरणा और मार्गदर्शन से आज हम मध्य प्रदेश के समस्त आयुर्वेद महाविद्यालय के शिक्षक वृंद, छात्र छात्रा और विभाग के विषय विशेषज्ञ और इस नेशनल वेबिनार में दूसरे प्रदेश के उपस्थित विषय विशेषज्ञों ने विचार विमर्श किया, उन सबको सबसे पहले माननीय मंत्री जी जिन्होंने हमें मार्गदर्शन दिया, बहुत बहुत धन्यवाद, जिन्होंने हमें प्रेरणा देकर कार्य प्रारंभ करने के लिए प्रेरणा दिया. द्वितीय, लगभग कोरोना काल शुरू हुआ तब से ही आयुष विभाग के लिए विशेष रूप से मार्गदर्शन देते हुए हमारे सचिव और आयुक्त महोदय डॉक्टर M.K. अग्रवाल सर, डॉक्टर L.L. अहिरवार प्रधानाचार्य शासकीय आयुर्वेद महाविद्यालय जबलपुर, डॉक्टर कदम विषय विशेषज्ञ, डॉक्टर अशोकन, डॉक्टर पंकज मिश्रा, डॉक्टर सुजाता सामकुंवर और डॉक्टर नारायण मिश्रा, जिन्होंने विशेष ऑर्गेनाइजेशन या मॉडरेशन और संपूर्ण इस विषय को कोऑर्डिनेट करते हुए संपूर्ण श्रोताओं को जो इस प्लेटफॉर्म पर जुड़े, उन सभी को भी धन्यवाद देना चाहूंगा, जिन्होंने उपस्थित होकर संपूर्ण लोगों को एक विचार और एक ज्ञान के साथ जोड़ा, जिससे हम आगे आयुष की विधा के अंतर्गत प्रसव, विशेष रूप से कुमार भृत्य विषय, जिसको हम कश्यप संहिता का विषय बताते हैं, उसकी विचारधारा और उसके प्रयोग को आगे बढ़ाने में मदद की है. मैं अंत में पुनः समस्त छात्र छात्राओं को और सभी को हृदय से धन्यवाद ज्ञापित करना चाहता हूँ। धन्यवाद।
धन्यवाद सर, आपके आशीर्वचन और आप हमें इसी तरह निरंतर मिलते रहेंगे, इसी आशा और विश्वास के साथ मैं इस वेबिनार को समाप्त करता हूं। और आप घर में रहें, सुरक्षित रहें और दूसरों की भी मदद करते रहें। धन्यवाद। नमस्कार।